Hey guys, welcome back to my channel. If you're new, my name is Carolina, and today I'm gonna talk about how the Rona thinks she can mess with nursing school experiences again. Okay, so you guys know that the Rona cases are going up in California, or at least LA, I don't know. All California, yeah, it's a mess again. And it's affecting nursing students again. Well, I mean, it has been, but things were starting to open up. Not open up, but at least for nursing students, things were starting to kind of get a flow again in terms of like going to clinicals and what we could do. So I was excited for these last couple of weeks. I'm an advanced med surge, so I'm almost done with nursing school, and I feel like I have little to no hospital experience. I do have experience, but I feel like I I wanted more. Basically, what I mean, this whole situation is messed up, but it is what it is. We can't do much anything about it. So we're going with the flow. I just envisioned my experience to be more, but in normal circumstances. But with this, I mean, obviously it can't be, so we have to make the best out of it. And so these past couple of weeks I had been going to a clinical site with my classmates, and it was so great because we were getting our experience in, and meeting patients, talking to patients, and it was nice. I was meeting a lot of nurses because a professor would have us like switch floors, and we would be partnered with different nurses, and I learned a little bit of of each nurse because they work differently. And so I was excited to actually get to speak to patients and take care of them and help nurses and figure out like how things flow. And it was nice. But okay, the corona is going up. So obviously, for safety reasons, hospitals are asking us to stay home and not go help. And obviously, because the nurses have so much to deal with already, like, we're just gonna be in the way, basically. And I guess, I don't know about PPE, but maybe it's lacking. So precautions are being put in place. We're not allowed to go back to our clinical site. So 2 weeks ago, something happened in my clinical site. So we went as regular, 6 in the morning. We went up. We were, placed with the nurse, and so we were all paired with our nurse. And then after lunch, one of my classmates was informed that one of his patients was COVID positive in a floor that's not for COVID patients. So basically, I guess I'm not sure if the initial test that they had made on this patient came negative, and then they tested after because the patient was showing signs. So they tested again, I think, and she came out positive. The patient came out positive. So one of my classmates was working with this patient, and another classmate was in and out of that room as well because another patient was in there. So it's like a shared room, and it's divided by a curtain. And these are patients that are COVID negative. So they're tested and they're COVID negative. That's why they're placed together, because they don't have anything. They're tested before they're placed there. And so this patient was negative, but then she showed signs. So then she came back positive. Okay. So for precautions, the classmate got sent home. And so then we were told what was going on, and we kind of left early, maybe like an hour or 2 hours earlier than usual. So it's like from 6 a.m. to 6:30. I think it was like an hour and a half earlier than what we were supposed to get out, right? Yeah, so that classmate was in contact with a patient who was COVID positive, and well, the classmate had an N95, and then like the regular mask that everybody wears, the still like a medical mask. But then after lunch, he forgot to put back his N95, so he just had the regular mask on. So that put him at like a risk, because he was there for a while with this patient. So he was told by the school and the professor to just stay home, quarantine, obviously get tested, and watch out for any signs. But everything was all right. I came into contact with him. I mean, it's not like he's gonna get it and then we get it the same day. So we were just looking out for symptoms. So everything was fine. Nothing COVID related came out of it. But yes, so now we are basically clinical less. We cannot go to clinicals because of what happened and because COVID cases are going up. So all of my friends who are like either in the same term or not in the same term are not going back to clinicals. And it sucks because we were getting hopeful and, wanting our experience, but it's not going to happen. You guys, it sucks. And especially for me, I feel bummed out because I don't have any medical experience other than clinicals. So clinicals is it for me. I do still volunteer at the LA Food Bank, which is some kind of volunteer experience. And, I don't have any other experience. I wish I could have had that earlier, but now I'm starting to stress out because, just for like new grad residency programs or like how to fill out my resume with like little to no experience. And those are the things that kind of get to me. And also like when these interviews like happen, they ask you about like situational or like ethical dilemmas you face during clinicals or at work. And I have sometimes I just have to think about it really hard and like, oh, that was that. But not being able to go to clinicals, you're less exposed to these situations. So yeah, we just have to make the best out of it. Now you see me dressed. It's the morning. It's 7 a.m. in the morning. I've been with my class in 6 today. Next week is Christmas, so we're gonna have a little break. Not with them. Well, I mean, at least me. We're staying here at home and just relaxing. Much needed. Maybe like for 2 days, because we have like a 2-week break, but that 2-week break is like proctored exam study and getting all my notes ready for finals. So that way when I come back, I don't have to like lag and like catch up again. You know what I mean? Like refresh. So I'll be refreshed all break long, and that is something that I have to stick to because I don't have any other choice. I want to score a level 3 on my proctored exam and an A in my final. So yeah. Today for my clinicals, because I wanted to come over here and talk to you guys really quick, we are doing virtual meetings. So we're gonna do Swift River. You might know what Swift River is already if you're in nursing school, and we're interviewing a patient, telehealth, via Zoom or whatever, and we're asking questions, myself and like classmates. So we already divided like what we're gonna ask, and yeah, so I'm very excited. Although we don't get that in person stimuli, we can call and interact with people via Zoom. I know the people, or at least the people that I've interviewed, not just in advanced med surg, but in OB and pediatrics, they enjoy communicating with others because, we're not really allowed to see or go out a lot. So they enjoy being talked to. And we do, just talk to us. So yeah, that's what's going on, guys. Clinicals are being shut down because of the Rona. Rona thinks she can mess with us, but we're gonna make the best out of it for now. Okay, guys, so I hope you guys enjoyed my little talk, and let me know how the Rona is affecting your nursing student experience. And we're gonna be new grad. Oh, I'm gonna be a new grad in a few months, so that's kind of scary to think about, like how things are gonna go. And like, residency programs are like not shutting down, but they're pausing, so it's kind of scary. Like, when am I gonna find a job? Am I gonna find a position that I want? Like, how is that all gonna go? Where am I supposed to be? Where's my my spot? My spot is out there somewhere, but where and when is the question. Okay, so you guys take care, and comment down below how this Rona is affecting you, and like how your clinicals were going, and then like, is it still going, or is it only us, or what? Okay, so I'll see you guys next time.